Hi, my name is Dr. Kimberly Talion, and I'm the Chair for Seminar Planning Committee 2017, which will be held at Las Vegas, Nevada, Paris Hotel. We are planning an exciting program in collaboration with Nevada Society Health System Pharmacists, and our theme is Sky's the Limit. I've asked several pharmacist leaders in the community to comment on our theme and what the future of pharmacy profession will be like.
One thing we know for certain is that the pharmacists of the future will be performing much fewer technical functions than they do today.
I see a greater involvement of pharmacists in doing what they're doing now. We have pharmacists in a very wide variety of settings: inpatient, outpatient, community health, you name it. There's a pharmacist in virtually every healthcare setting. And I anticipate that we'll see a greater visibility of pharmacists. Patients will come to seek their care and they'll ask, where's the pharmacist on my care team? Much as now they're asking, where's the physician and where's my nurse? They're going to ask, where's my pharmacist?
Inpatient pharmacists could have expanded roles where direct patient care is the norm, and patients would recognize pharmacists as an important member of the healthcare team above and beyond their traditional medication dispensary roles. I would expect that outcome metrics and cost-saving initiatives would be the norm in terms of expectations and deliverables.
In some healthcare settings, pharmacists' roles in medication management is well established and is expected. For example, in the hospital setting, pharmacists are well recognized as experts in medication management. In the outpatient setting, there's been a delay, there's been a lag in that process, largely because of the lack of national provider status for pharmacists. However, that's changing because many states, as you know, have begun to recognize pharmacists as providers, and CMS themselves have created great opportunities for pharmacists to contribute to improving medication-related outcomes through things like bundled payments and pay-for-performance programs that are largely focused on medication-related outcomes.
Most pharmacists have those skill sets, they just haven't accessed them for a while. I'm thinking about things like basic physical assessment, appropriate medical documentation, and interprofessional as well as patient communication. All of these things are going to be essential as we see pharmacists more and more involved in direct patient care.
For pharmacists in the ambulatory care setting, and this would include the rural setting, critical access, hospitals and clinics, I see their roles expanding with reimbursement for their clinical services. This would dramatically help improve access and improve safety and cost, and extend the physicians that are stretched pretty thin in the AmCare setting.
Much like in the world of medicine, pharmacists need to be optimally applied in medication management, and they need to have technical functions, what they do every day, managed by somebody else. In the medical world, that somebody else is typically a medical assistant or a nurse. In the pharmacy world, it really needs to be the pharmacy technician. Technicians are fantastic at so many different things that we don't give them enough opportunities to take part of.
Technicians may have a more patient-facing role than they do now as they interact with patients who are there in that setting to actually have an encounter with the pharmacist. So technicians will need to think about their patient communication skills as well as some of their documentation skills as well.
I think expanded roles in managing transitions of care would also be a possibility for our technicians. Med reconciliation could be solely managed by our pharmacy technicians with advanced education and training for competency in that area.
We look forward to seeing you at Seminar 2017, October 26th through the 29th at Las Vegas, Nevada, Paris Hotel.